Hi, thanks for tuning in. My name is Matt Perry. I'm a professor of health policy and management at Monash University. And joining me is Caitlin Thompson, who's a researcher for the Department of Health and Human Services. And we're presenting a project that's based around the focus of health literacy in Victoria. So I'll just quickly introduce the topics that we'll be talking about. So firstly, we'll be kind of justifying why health literacy is an important factor to be looked at. And then I'll outline the current situation in Victoria in terms of health literacy. And then finally, we'll provide some practical strategies and a way forward for how we can improve health literacy for the younger generation and the wider community as well. So I'll hand over to Caitlin for our first topic.
Hey everyone, so today I'm going to start out about talking about why the health literacy is important amongst the Victorian population. So sufficient health literacy has been recognised as an important determinant when working towards quality public health for all Victorians. The lower level of general literacy and numeracy skills often relates to and coincide with a similar, if not lower level of health literacy and understanding. So health literacy is an important set of skills and knowledge that all Victoria should have the opportunity to learn about and attain due to the significant life benefits that Victorians will get in conjunction with that understanding. So if a greater percentage of the Victorian population had a better understanding of health literacy, the incidence and prevalence of both non-communicable and communicable diseases will likely decrease, along with the stress and pressure that is placed on the health systems within Victoria. So it is recently known that over half of the population currently in Victoria are quite likely to have substantial difficulties reading, interpreting, and practicing health-related information that's presented to us by health professionals. So this not only includes reading reports and interpreting graphs and the deeper level understanding stuff, but even just some of the daily understandings that you see and present recommendations that you see on Facebook and in newspaper articles and throughout the media. So we believe that the biggest gap in understanding and reading and interpreting the health data is not necessarily reading it at face value. A lot of people can understand, wear a mask or wash your hands every day. And that's not necessarily the biggest issue that comes with health literacy. It's understanding the why about it. So if people know that, washing hands actually does reduce the bacteria and the virus that may be living on your hands, and then when you're eating and stuff, it won't be transported as easily, then they're more likely to actually do that recommendation and incorporate that recommendation into their everyday lives. So providing them with the clarity around what the recommendations are actually trying to say often encourages them to be able to attain these practices. So moving forward from that, the risk and protective factors are one thing that health professionals often know and understand, but struggle to get across to the everyday community in a way in which they will understand it without having to read 10 papers on it. So by doing this and hopefully then working towards a better understanding of the general population, it's more likely to decrease avoidable hospitalisation and therefore improve the general health amongst the population. All right, Matt, I'll pass back over to you.
Sure. So the current situation in Victoria. In Victoria, there's a real need for improved health literacy, and that's why we've been a part of this partnership, because our vision is to empower individuals to take control of their health and be able to make informed decisions that will benefit their health and well-being. So I just want to provide a bit of context and I suppose provide a rationale for some of the strategies we're going to discuss later. So currently, the provision for improving health literacy at a policy level is lacking. A study conducted by Trezona et al. Found that within key policies such as the Victorian Public Health and Wellbeing Plan, the topic of health literacy was inadequately addressed. And if policy is the driving factor for implementing change, then health literacy really needs to be recognised as a key priority within these policy documents. I just want to provide some key statistics as well, just to give you a picture of how well Victorians are able to access and understand health information. So in a survey conducted by the Australian Bureau of Statistics, 14% of people reported finding it difficult to navigate the healthcare system. 17% of people disagreed or strongly disagreed that they could appraise health information, and 8% of people reported finding it difficult to understand health information. And in the current COVID-19 situation, health literacy is a vital tool that we can use to build a strong community response against the virus. And there's so much information that needs to be articulated clearly to the public. And I think during this pandemic, the Victorian government has really had to rethink how they reach different groups of the population. So this COVID-19 pandemic has really highlighted the need to reach different groups of the population. And I guess, it gives us a picture of what it could look like if we improve the response to addressing health literacy in other areas, not just dealing with this virus. So I'll hand over to Caitlin for the next topic.
All right, so now I'm going to start to address how we believe we can help move forward and improve Victoria's health literacy across the state and through all different kind of populations. So although there's a small section of the curriculum that is dedicated to health literacy, I feel as though the topic in general needs to be a bit further discussed and focused on throughout schooling to help the younger generations really nut out this issue early on in their schooling. So if they're always kind of given the opportunity to improve these skills, and by the time they become adults, there's a greater chance that they're going to further understand this and therefore improve the health of the population. So there is a section in the curriculum that throughout the year 7 to 10, just content description that focuses solely on improving health literacy and reading and interpreting data. But from recent experience, it's kind of seen that they don't often, as a topic at school, focus on health literacy. It's more a broad focus across the entire year's work. So they'll be talking about drugs and alcohol, and then they'll start to interpret some data and read some statistics and get the kids to show their understanding in that sense. But it's kind of not focused on solely as an issue, which I believe, as it's something so important, especially in the population at the moment, it should be further addressed. So in order to do this, we're going to focus on 3 strategies within this initiative to help improve the health literacy of students at school. So the first one is by increasing professional development opportunities for educators themselves, specifically focused on teaching the topic of health literacy, rather than just ticking it off because they've taught it throughout other issues that they've presented in their lessons. So this would be seen through both in-person and online accessible conferences, webinars, and online reading material. So by having the opportunity for both in-person attendance and online attendance, that allows for those people that are there in person to ask questions and get a deeper understanding at a more personal level than just watching an online interview or something along those lines. But then by also having that online option and the recording viewing option, it allows for people that may not be present in the middle of this initiative that we're trying to present, the opportunity 3, 5, 10 years down the track to come back and have a look at what we've presented. So the next strategy that we're going to use is to, very similar to the one I've just spoken about, but more specifically focused on pre-service teachers and opportunities for them to gain a greater understanding on how to teach and activities that you could use to help promote better understanding of health literacy within their classes. So as I said before, it's going to be very similar in what I was just talking about with online conferences and webinars, but a greater focus on pushing it in universities and TAFEs and those other kinds of courses that educators will be taking at a younger, I guess, age in their career. And then the third one, which is kind of our last strategy that we want to implement when working with young kids at schools, is by creating a document of resources for teachers and for pre-service teachers to use to make their job easier, I guess, when it comes to teaching these things in their classes. So we want to provide a document to all schools within Victoria to help provide an overview of the issue and how to tackle it within their class. So we'll have some example activities, a video series to watch in class, full lesson plans, worksheets, quiz and test questions to help the teachers see the student progress and then hopefully make it easier for those teachers to implement this stuff into their classes. So I will pass back over to you, Matt, to talk about our second initiative.
Yeah, thanks, Caitlin. So I guess to reach out to the wider community, the people who aren't in schools anymore, I think you have to address the different environments which people will be accessing health information. And from the data provided by the 2018 Australian Bureau of Statistics survey on health literacy, the two most prominent contexts where there's difficulty interpreting health information are within healthcare providing settings, so doctors, hospitals, those kind of settings, and within the home. So yeah, looking at a healthcare setting, there's social interaction between the health professionals and the patients. So we've identified communication as the key priority that needs to be developed to ensure that patients can understand the information that's being given to them. And research from a study done by Sophie Hill found that in Victoria, many of the interviewed medical professionals didn't feel as though communication skills was an area that was taught well in their training. So a strategy that we believe will improve communication skills from health professionals would be to partner with university faculties and ensure that communication is a key area that is addressed within the courses, so that medical professionals can go out and effectively communicate health terms that patients might not understand, and yeah, just ensure that the patients actually understand what they need to do to look after their health and well-being. And throughout the COVID-19 pandemic, this issue of having clear communication has been highlighted, especially with members or individuals from diverse cultural backgrounds. And in the situation where there's contact tracing going on with large households where there's been an outbreak, there's been a need to communicate well between members of these families who might have a different language background other than English. So if we look beyond just containing the spread of a virus, we need to ask, what are some of the other health issues that are present within our community, and how do we support individuals from a diverse cultural background in dealing with these health issues? So I think the most effective way to engage with these with a variety of cultural backgrounds is to form partnerships with organizations or members from these different cultural groups who can represent the culture and traditions within these groups. So for example, to engage with the Indigenous population. There needs to be communication with elders and leaders from Indigenous groups about some of the barriers, and just working with them to find strategies that can be done in a way that is culturally sensitive and appropriate to meet the needs of these individuals within these groups. So yeah, that's kind of an outline of the strategies that could be used to reach both the younger population and also the wider community. So yeah, thanks for tuning in, and we hope that it's been helpful for you as well. Thank you.
Thanks, everyone.